Hi, I'm Sam English, founder and CEO of AttentionPoint. Welcome to our webinar. Today we're going to discuss the clinical benefits of DefiniPoint. Today we're going to cover the best practice ADHD assessments, which relies on DSM criteria, and the critical role that informants play as part of that assessment process. We're also going to discuss the rating scales used to gather that information, how the results can be integrated together, and then how DefiniPoint improves the entire assessment process, the benefits, particularly focusing on the clinical aspects, and then we'll briefly discuss the instruments involved. There's a separate webinar that goes into more detail about each of the instruments inside of DefiniPoint. We will not get into detail into that in this talk. ADHD, as you know, is a common neurobehavioral disorder. In fact, about 10% of all school-age children in the U.S. have been diagnosed with ADHD, and that's over 6 million children. And the diagnosis rate has been increasing at more than 5% for more than 10 years now. Best practice assessments from the American Academy of Pediatrics as well as the Psychiatric Association recommend using rating scales, standardized rating scales, to gather information about the child's behaviors from both the home and school settings. Best practice assessments utilizing DSM-5 criteria relies on the frequency and the severity of these ADHD symptoms. Now, the information about that, of course, comes from interviews of the client, but then also information about parents and teachers' observations of those ADHD symptoms. And again, utilizing standardized rating scales to gather that. ADHD rating scales have been around for quite some time. In fact, they've evolved over the last 20 years. And here are some of the more commonly recognized ADHD rating scales. Because they've been around for more than 20 years, they're still mostly paper and pencil based process of gathering information from parents and teachers, which is a real challenge in getting information back from parents and teachers. Here's a study that was done a few years ago looking at the clinical utility of rating scales. And in this particular study, what they did was they looked at 4 different rating scales, and they had 108 children that were definitively diagnosed with ADHD, 78 children that were definitively not diagnosed with ADHD, and they looked at the ability for each of those instruments to accurately classify those children as to their ADHD status. So here you can see the rating scales that were used, Achenbach's Child Behavior Checklist, the teacher report form, 2 of Connor's forms, so the parent and the teacher. Looking at the sensitivity and specificity. So the sensitivity is the ability of the instrument to correctly identify children, in this particular case, with ADHD out of a mixed population. Now conversely is the specificity, which is the ability of the instrument to identify children that do not have ADHD in a mixed population. So overall, the rating scales perform at about the same level of identifying children with ADHD, but the ability of rating scales in general to correctly classify children, identify and classify children that do not have ADHD is poor at best. One of the things that they were able to do in this study is to integrate the results together. And so here they were actually able to take these 4 different rating scales and improve the sensitivity and, more importantly, the specificity by integrating multiple rating scale results together. The net of the study, the takeaway from the study, is that there's no single rating scale, and particularly there's no single informant that's going to be the best position to provide accurate information about the child's ADHD. And in fact, the superior approach is integrating multiple pieces of data together into a single result, improving the sensitivity and the specificity. Other studies, numerous studies, also support the validity, the value of having additional information. So here's a one that was looking at clinically referred children where there was information available only from teacher, looking at the ADHD positive diagnosis rate, parent only, again, both of those at about 40%. When information from both of those informants was integrated together, dropped the diagnosis rate down to about 28%. Here's another study that essentially showed the same results. Teacher-only information at about 60%, parent-only information at about 80%, integrated together, got it down to about 6%. And one last study, again, same takeaway, teacher-only information at about 36%, parents at about 12%, again, integrating multiple pieces, dropped the diagnosis rate down to 6%. So with DefiniPoint, what we do is we take individual rating scale results and convert those into probability scores. We're then able to use Bayesian algorithms to integrate these probability scores together to give a single probability score. Our research conducted at the University of Virginia supports our clinical framework, and here are 4 publications, 4 peer-reviewed publications describing our approach. And here's the results of one of those particular studies. So again, looking at the ability of multiple data points to be integrated together to improve the classification accuracy. So as I described, we look at it from a probability perspective, so from a 0 probability to a 100% probability. In this study, we started with 50 children that were definitively diagnosed with ADHD, 50 children that were definitively not diagnosed with ADHD. Now initially, everyone starts in the middle at a 50% probability, and then upon gathering information about the child's behaviors, we're then able to begin to separate and classify the 2 groups. So here we're looking at the children that did not have ADHD, moving toward the ADHD negative sign, and here ADHD positive sign. And this is with 1 data point. As seen in those earlier studies, the unfortunate reality is having a single data point leaves a lot within this gray zone, which is ambiguous at best. Integrating 2 data points together dramatically improves the ability of rating scales to distinguish between children with and without ADHD. So here you can see the migration, the classification of those without ADHD and those with ADHD, dropping them away from that gray zone. 3 data points improves it still further dramatically, and actually if we look at here, we can compare the sensitivity specificity from single data point, 2 data points, and then 3 data points together. Most importantly, we increase the specificity, which is that ability to accurately classify children that do not have ADHD. Now, of course, all of this is part of a comprehensive evaluation. We're very focused, of course, on rating scales and ADHD symptoms, but all of this, at the end of the day, is about getting information from multiple perspectives around the child to perform a comprehensive, thorough evaluation. Home settings are not as simple as they used to be. The Ozzie and Harriet families, unfortunately, really aren't around that much anymore. And so therefore, it's quite often the case that information from multiple individuals is needed to get an accurate picture of what's happening at home. So in many cases, that may involve parents, grandparents, aunts, uncles, whoever's in the child's life at home. School settings have become more complicated as well. The one little schoolroom house, they really don't exist much anymore. In fact, most students have multiple teachers these days. And as we saw before in those earlier studies, if we rely on information from a single teacher, it's inherently going to be biased. So the question would then be, well, which teacher would then provide the most accurate or the most helpful information? Would it be the homeroom teacher, the math teacher, science, or maybe the English teacher? In reality, all need to be involved and provide information into the assessment process. Now, unfortunately, because the current process is paper and pencil based, it's cumbersome, time consuming, and unfortunately results in missing information. The process starts with the clinician handing a packet of rating scales to the parents. The parents get rating scales over to the teacher somehow, and the teacher and parents hopefully complete the rating scales, provide those back to the clinician's office. Now, unfortunately, those don't always come back, and particularly they don't come back in a timely manner, which means that the office needs to then follow up, remind, and find out and track down rating scales. Once they do come back to the office, it's a matter of then receiving and tracking that information, and then, of course, scoring the rating scales by the clinician or staff. And then ultimately, of course, the results are interpreted and a report prepared. So it's a cumbersome, time-consuming process, particularly for the clinician and the staff. So when gathering information from multiple informants, multiple parents and teachers, because of this, it results in missing information. So contrasted with the paper and pencil process with DefiniPoint, we've automated this assessment process. So the clinician assigns rating scales on the front end. Emails are automatically sent to the parents and teachers. They log in to our HIPAA-compliant secure system, complete the rating scales online. The rating scales are automatically scored, the results are integrated together, and reports are generated. The clinician is then able to review the results and well as reports generated. Critical in this process is reminding the parents and teachers to provide the information via the rating scales. And that is done automatically via emails to the parents and teachers. So the clinician is only involved in here on the front end as well as on the back end. DefiniPoint takes care of the process in between. So DefiniPoint makes it easy to gather information from multiple individuals. And in fact, clinicians using DefiniPoint right now have a greater than 90% return rate of rating scales. At the end of the day, we're talking about gathering information easily that supports your clinical judgment. Now, as I described, we use Bayesian algorithms to integrate the data together. One of the challenges of getting multiple pieces of information is then being able to make sense of it quickly, efficiently. As I described previously, what we do is we convert from rating scales into probability scores, integrate the probability scores together to give a single result. Now, the way that we handle data, all of the raw information is still there available to you, but we integrate it so that you can actually work backwards and then dig into whatever information you want to tease out parts. So DefiniPoint is easy and convenient for parents, teachers, and clinicians, allows for a rapid diagnosis, and we combine the results together for a clear, simple result. Not only does it help with the initial evaluation process, but it particularly is helpful for the outcomes management over time. So managing children that have been diagnosed with ADHD, setting a baseline, and evaluating the efficacy of intervention. So within DefiniPoint, we have a variety of instruments available. So we have ADHD rating scales, all based on DSM-5 criteria. These are standardized, psychometrically validated, widely accepted rating scales, normative data. Rating scales available for children, adolescents, and adults. And we also have impairment rating scales. So these impairment rating scales look beyond just the ADHD symptoms, but actually look at the effects of ADHD on relationships around the child, and we also have an impairment rating scale for adolescents and adults as well. So looking at how ADHD impacts the child and the environment around the child, particularly helpful for looking at outcomes. And then we have medication monitoring, so looking at side effects of medication as well as efficacy, particularly timing and dosing during that early titration period. So DefiniPoint makes the data gathering easy. As I mentioned, greater than 90% return rate right now, and in less than 4 days. And we've also surveyed parents and teachers about DefiniPoint. They like it. It's simple and convenient. Takes less time to complete the rating scales. And for those that have been involved in rating scale processes before, 78% find that it's better than their previous experience. So at Attention Point, we're committed to taking technology that we use in our everyday lives and translating that into simple tools to really improve your clinical practice. If you have any questions about DefiniPoint, don't hesitate to contact us. There's lots of other information available on our website. There's frequently asked questions, tutorials, and there are other webinars. As I mentioned, in particular, there's a webinar that focuses exclusively on the instruments inside DefiniPoint and how to use those in practice. Again, if you have any questions, feel free to contact us. My email address is on the website, and thank you for your attention.